Okay, so next up we have the humerus, and we have the also known as the long bone of the upper arm. Parts of the humerus to be aware of would be the head of the humerus, which articulates with the glenoid cavity and the glenoid cavity of the scapula to form the shoulder joint. You have the anatomical neck of the humerus. Where did you go? There you are. Anatomical neck of the humerus marks the boundary of the articular surface. You have your radial tubercle, where you will find your rotator cuff muscles attaching to there. You have your lesser tubercle. Sorry. There it is. So here we are. Greater tubercle, lesser tubercle. Smaller bump on the anterior side of the proximal humerus. You have your bicipital groove of the humerus between the two tubercles, where the biceps brachii tendon will lie. Your surgical neck is your common site for fractures. The shaft of the humerus is going to be this long, the long bone, or the long area of the humerus as well. Within the humerus, you have your deltoid tuberosity, your radial groove, both places for their matching muscles. The capitulum of the humerus, which articulates with the head of the radius. The trochlea articulates with the ulna, your orecranon fossa. Work with me now. Okay. Olecranon fossa, depression of the posterior side of the ulna, which fits when the elbow is extended, and the coronoid fossa, the radial fossa, where the parts of the ulna and the radius sits during elbow flexion. When we talk about what innervates the radius and what nerves pass through the radius, you have your radial nerve, which runs along the posterior shaft of the, I said radius before, excuse me, humerus. Your radial nerve runs along the posterior shaft of the humerus and innervates the muscles of the posterior arm and posterior forearm. The ulnar nerve runs behind the medial epicondyle. Your medial epicondyle is most famously known as the funny bone. So this would be the groove that it would run through. The median nerve passes the anterior distal humerus and provides innervation to most of the flexors in the forearm. And your axillary nerve runs through the surgical neck of the, runs around the surgical neck of the humerus, innervating the deltoid and teres minor muscles. But because the surgical neck is the most common place for fractures of the humerus, you can find that the axillary nerve is most commonly affected from injuries to that area. When it comes to blood supply, within the humerus, you have your anterior and posterior circumflex humeral arteries. These vessels encircle the humerus near the shoulder and supply blood to the head and neck regions. You have your suprascapular artery. You also have the anterior and posterior circumflex will run near the cervical neck areas, and wrap around the humerus that way. In terms of a distal humerus, you have the deep brachial artery, also known as the profundus brachii, which supplies blood to the posterior arm and runs in the radial groove alongside the radial nerve. With the surrounding structures, there are a lot of muscles within the humerus. Starting at the top, you have deltoid muscles, innervated by axillary nerve, like once stated before. It covers the proximal humerus. You have your rotator cuff muscles, which include the supraspinatus, infraspinatus, teres minor, and scapularis, and attached near the head of the greater and lesser tubercles, stabilizing the shoulder. You have your biceps brachii, innervated by the musculocutaneous nerve that run along the long head tendon through the bicipital groove. Your triceps brachii attaches to the posterior shaft and extends the arm. Your forearm flexors and extenders, and these muscles move the wrists and the fingers. When it comes to the embryonic origins, it'll start at birth around the fourth or fifth week. You have your mesenchymal condensation. The cells will condense the shape of the future humerus, and then your endochondral ossification begins with the formation of cartilage, and followed with the replacement of cartilage by bone tissue. Your primary ossification center develops in the shaft of the diaphysis and during fetal life, and then your secondary ossification centers develop after birth in the proximal and distal epiphysis, allowing for the humerus to grow in length during childhood.